myself Dr. Rajkumar Archobe, and I am here to discuss dental consideration in hemophilic patient. These are the content of my presentation. Under this title, we will discuss everything about the hemophilic patient for the dental consideration. So, hemophilia is the congenital plasmatic hemorrhagic diathesis. It is X-linked recessive disease which is occurred due to the chromosomal mutation in the factor 8 called as hemophilia A and factor 9 called as hemophilia B. In the worldwide, more than 4 lakh pupils are affected with the hemophilia. In that, type A is more common as compared to type B, and this is affecting approximately 1:5,000 in the males. Every dentist faces the bleeding during his or her treatment. So in dentistry, most of the time soft tissue laceration may be possible, some gingival damage may be possible. So if the patient is hemophilic, then this care should be taken. What are these care? We will discuss later on. So if bleeding is not stopped in hemophilic patient, then it is the biggest challenge for the dentist. So my topic is very much important for management of the hemophilic patient. Why blood is not clot? It is a blood disorder. Bleeding is not stopped. Blood does not clot. Why this will happen? There are many factors, but related with the three things, like either there is defect in the blood vessels, like Ehlers-Danlos syndrome or fragility of the blood vessels, or there is some abnormalities in the coagulation mechanism, like hemophilia A, hemophilia B, or vitamin K deficiency or liver disease, anything, or blood platelets, there is deformity in the blood platelets, like quality or quantity of the blood platelets. Scientific standardization of the International Society on Thrombosis and Hemostasis divides this hemophilia in three groups, like severe, moderate and mild. In severe form, the factor level is less than 1% of normal. In moderate form, it is between 1 to 5% of the normal, and in mild, more than 5 up to 40% of the normal factor level is there. Then it is considered to be a mild type of hemophilia. Bleeding disorder management is slightly difficult for the dentist, so there is close cooperation or close relationship is required between the oral surgeons and hemophilic treatment center or hematologist. So my aim of presentation is how to take care of hemophilic patient in the variable dental procedures. After discussing the patient and the dentist or with the hematologist, we will come to the fine diagnosis and fine treatment of the hemophilic affected person. So directly or indirectly, my presentation surely benefits to dentist and the patient both. If any dentist or any doctor has any doubt that the coming baby is hemophilic by taking the history, if there is any doubt, then gene testing is there to decide the coming baby is hemophilic or not hemophilic. This gene testing is possible by taking the sample from the placenta, or when birth is occur, then blood test is the easiest method to diagnose the hemophilia A or B. I am here to discuss the oral manifestation of the hemophilia. So there is bleeding signs at the multiple sites in the oral cavity, like from the gingiva or the extraction socket. If we take the history, then we find that there are multiple events of bleeding or episodes of bleeding over the lifetime. History is mandatory to diagnose or to manage the hemophilic patient because, according to Sonis and Musalman et al., he has found that 29.1% of bleeding events per year occur, out of which 9% is involved to the oral structure, that is labial frenum, tongue, buccal mucosa, followed by gingiva, and rarely on the palate. What the precaution we have given to the hemophilic affected patient? We ask hemophilic patient or any person, but hemophilic patient especially, that brush twice a daily with the fluoridated toothpaste. In normal, we use 1000 ppm of fluoride in adult dose, but in hemophilic patient 1000 ppm fluoride is recommended for the children below 7 years of age, and above 7 years of age 1400 ppm fluoride is mandatory, because this fluoride avoids the decay in the tooth, and if decay is occur, infection is rare and inflammation is rare. So if inflammation is rare, then bleeding is naturally rare. Medium texture brush is required, toothbrush is required, because if we use soft bristle brush, then it is unable to clean the plaque, or if you use hard tissue brush, then it corrodes or eroded the enamel, or it produce some pressure on the inflamed gingiva and produces bleeding. Interdental cleaning aids is required, like interdental floss or interdental brush. All these things definitely helps to control the caries. Higher sugar content foods or drinks should be limited. In place of sugar, you can use artificial sweeteners that will decrease the chances of occurrence of caries. And regular visit every after 6 months of interval is mandatory to check the oral hygiene. Before start any dental procedure in the hemophilic patient, there is planning. Every dentist has to make a contact with the hematologist of the patient, hematologist or doctor of the patient, or the nearby hemophilic center, to cover the emergency if occur in future. Dentist does not faces emergency in their clinic, but once in a lifetime if emergency occur, then this will be difficult for the dentist. So there should be a care should be taken during the management of the hemophilic patient, like careful use of saliva ejector. Don't be use harshly to aspirate the saliva, or careful removal or insertion of the trays during the impression, or taking the x-ray. You can place x-ray very gently so that there will be no damage to the soft tissue and no bleeding will develop. In every dental clinic, anesthesia is given for any dental procedure. So, and why the patient comes to the dental clinic? They have pain, patient has the pain, and they visited to the dental clinic for the needful treatment. For pain control, simple analgesic, minor analgesic like paracetamol or acetaminophen should be given. No NSAIDs is given because NSAIDs inhibits the platelet aggregation. So bleeding is slow down, clotting mechanism is slow down. During the use of the anesthesia, nothing to worry about the anesthetic agent. You can use any anesthetic agent like lignocaine, but preferably articaine is the best suitable anesthetic agent, and that will with the vasoconstrictor. If you use like epinephrine or like adrenaline, then this vasoconstrictor helps to stop the bleeding during the treatment. In this slide, you can see buccal or labial infiltration is the safest to get anesthetized the area, because and there is no need for the factor replacement. Simple hemostatic agent is sufficient to manage the bleeding, but nothing to worry in the labial or buccal injection. Nothing to worry during the intraligamental injection also, and intraosseous injection. You can give safely without any hesitation. But when you give inferior alveolar nerve block, then there is chances of occurrence of bleeding in the retromolar or pterygoid space, and that bleeding creates hematoma that block the airway, and there may be possibility of death also. So during inferior ulnar block, there is requirement of the factor replacement, and in the lingual nerve block also there is lingual plexus. So if you inject lingually anesthetic agent, then there may be chances of the damage of the lingual plexus and hematoma will occur. Tongue will uplifted and that will fall down back, and it causes the airway blockage again. So lingually near to the bone is to be taken care and not to be given in the hemophilic patient injection. Buccal, labial, intraligamentary and intraosseous injection should be given without any factor replacement therapy. So there are multiple branches in the dentistry. One by one I will discuss in the different branches under which we will perform the treatment. Like in endodontics, we do the RCT and we save the tooth. In RCT, in endodontics, there is low risk of bleeding because we do RCT in the root canal, and that file should not be go beyond the root or does not go beyond the bone. If it goes beyond the bone, then there will be the bleeding occur. In canal, when we perform, there may be chances of bleeding, but that bleeding is due to the vital pulp or infected pulp that will stop after the irrigation of the sodium hypochlorite or calcium hydroxide or formaldehyde derivative substance. But if bleeding does not stop, it means this is due to the hemophilia. So in hemophilia, we have in our clinic this apex locator. This apex locator decides or limits our approach inside the root only, not beyond the root. If we go beyond the root, this apex locator beep out. So this is the best suitable instrument for the dental clinic. And in hemophilic patient, care should be taken. You will be limited up to the canal within the tooth. Don't go beyond the tooth. According to Atra RR et al., they stated that they carried out one study in that they provide antifibrinolytic agent like tranexamic acid, and pressure pack is applied on the swelling where they give incision, and that bleeding hemostasis is achieved. So simple antifibrinolytic agent is also works if any swelling is present in the oral cavity. Another discipline of dentistry is the prosthodontic procedure, where the bleeding is low because we generally take the impression, just take the care of doing the impression by putting the trays inside and outside. It is gentle to be applied. The pressure should be gentle. Dexterously impression is taken, prosthesis is prepared. If we prepared prosthesis, we take the support from the neighboring tooth, then care should be taken that natural tooth or neighboring tooth is to be periodontally healthy. That should be maintained. Gingival health of the neighboring tooth should be maintained properly. Third branch is the orthodontic branch, where the bleeding complication is rare because only when the braces is applied, that braces will cause piercing on the soft tissue, then bleeding will start. So care should be taken not to impinge this braces or metallic thing to the soft tissue. Another, during the extraction procedure, we just give the antifibrinolytic agent, and by giving the care, you can extract that tooth. Simple by the labial or buccal infiltration. Interdental care is taken by using the orthodontic brush to maintain the oral hygiene so that the inflammation is less and bleeding will not occur in the future. In the restorative procedure, rubber dam should be applied to isolate the tooth, because during the application of the wedges, wooden wedges and the this metallic band, stainless steel band, that will cause pressure to the gingiva and bleeding will start. This band should, why to place this band? Because we place this band that when we feel this affected tooth, this filling material does not touches to the neighboring tooth, because both the teeth should be separate during the filling. So if we place this band or wedges, then bleeding will occur, possibility of bleeding occurrence. So we can use the hemostatic agent, we can use the rubber dam, and you will do your treatment. In the periodontal treatment, this is another discipline of the dentistry where healthy periodontium is required. If periodontal oral hygiene is poor, then as soon as possible you can maintain the oral hygiene. In severe periodontal disease, just do the supragingival scaling and ask patient or educate patient for the maintenance of the oral hygiene. Subgingival scaling is only done when the inflammation is reduced. Treatment is carried out in the several visit. Don't start treatment and finish treatment once in a single visit. Chlorhexidine gluconate mouthwash, hemostatic agent, antifibrinolytic agent should be given. Antibiotic is prescribed to control the initial inflammation and infection. And periodontal surgery is risky as the extraction of the tooth, because gingiva is highly inflamed and there is chances of bleeding is more. So carefully perform this treatment, and before doing the treatment, just explain the patient what I will going to do and what will be chances of occurrence in future. That will be discussed prior to start the treatment. Another surgery is another discipline of the oral dentistry. In that we can perform the extraction, periodontal surgeries, implant placement by giving 10% of solution of tranexamic acid mouthwash, or by monitoring the blood pressure by giving the benzodiazepine, that will reduces the worry or anxiety of the patient, and also control the blood pressure, so chances of bleeding will less. Literature has suggested that by simple giving the antifibrinolytic agent and hemostatic replacement therapy, or applying the local hemostatic agents or local hemostatic splints, this bleeding will stops, or there is less episodes of bleeding during the surgery. Simple, there is guideline. Just do the clinical examination, take the history, do the radiographic examination, do prophylactic cover. If multiple extraction is required, do one or two extraction. Do the follow up overnight for the patient. For the occurrence of bleeding, just examine is there bleeding occur or not by extracting simple one or two tooth. Ask patient for the social circumstances, like how they live, either live alone or with the family members. Discuss the hemophilia unit for arranging, administrating or monitoring the products, or administering the hemostatic agent or factor replacement. Discuss the use of local hemostatic agent, oxidized cellulose or fibrin glue. Consider the use of antibiotic to cover the inflammation or infection before extraction to prevent the bleeding. Always carry out the treatment atraumatically. Atraumatically means by giving a minimum trauma to the area. Preoperative care is very much required. I will discuss that. History is important. Maintain the oral hygiene by removing the calculus and plaque. Use antibacterial mouthwash. Antifibrillary agent like tranexamic acid 1 gram TDS for 7 days. During intraoperative, just carry out a traumatic treatment. Suture the inside operated portion with the absorbable suture, so that the next time there is no chances to remove the suture again. Post-operative care, ask patient after performing your treatment, ask patient to not to rinse, not to smoke, not to take hard diet, don't do strenuous exercise activities for the 24 hours. Take the medicine, prescribed medicine, and instruct how to take that medicine. Salt water mouthwashes Gargle is required 4 times in a day for 7 days, and emergency contact details should be given to the patient. If there is any emergency occur, then he or she immediately contact to you. Manage all the oral infection by giving the antibiotics. In oral cavity, streptococcus viridans, anaerobic, gram-positive and gram-negative cocci and rods are commonly occur the oral infection. So penicillin is the best choice of medicine. If there is allergy to penicillin, use the erythromycin or clindamycin. Clindamycin is having the higher alveolar concentration. When it is given 150 milligram every 6 hourly, then it produces the bactericidal effect. Clindamycin is the best medicine. And if there is allergy to the penicillin like amoxicillin, and metronidazole imidazole group medicine, that is also best suitable medicine for the anaerobic bacteria. Topical use of chlorhexidine gluconate and mouthwash should be given. There are local measures are available to stop the bleeding like sutures, collagen valleys, oxycellulose, gelatin, cyanoacrylate. All these are things. There are two studies, Pesker A et al. And Wagner et al. They performed the study by giving the absorbable suture and pain control NSAIDs or aspirin should be avoided in their study. And use of hemostatic agent, how that hemostatic agent act, like what is their ability to mediate the platelet aggregation or deposition. They found that in that collagen is the best local measure, followed by the gelatin and the oxidized regenerated cellulose. These are the list of the brand name of the hemostatic agents available. Fibrin glue is one of the antifibrinolytic agent, local hemostatic available. It produces the hemostasis and avoid the clotting factor replacement therapy chances. In dentistry, if we want to extract one or two tooth, just before extract the tooth, you take the impression, negative replica is coming, just pour it with the dental stone, prepare the cast model, the positive part, remove the tooth that will that you want to extract in the future. That tooth should be removed by using the plier, and then the soft resin is used to prepare the splint, and that will be placed on the after extracting the tooth. You can place it in the oral cavity for 48 hours, and it will allow to stop the bleeding by mechanical method. That is the splint you can prepare in your clinic also easily. There are systemic measures are also available. World Federation of Hemophilia advise the use of factor concentrates like cryoprecipitate or fresh frozen plasma for the replacement therapy. And post-operative factor maintenance is also required for extensive surgery. If you perform any extensive surgery, then post-operative factor maintenance is also required. Ubansky et al. Advised that Ubansky et al. Advised that factor 8 will or factor 9 will increase 50% of their regional or infiltration local anesthesia. Ubansky et al. Advised an increase of factor 8 or 9 to 50% of either regional or infiltration anesthesia. For infiltration anesthesia or periodontal curettage, you can just use the lower doses of the clotting factor concentrates. But in the invasive surgical intervention, you can use 50 to 100 international unit of factor replacement, factor concentrates operatively, or oral antifibrinolytic agent should be followed by post-operatively. Sedent and Pedersen Uh, they found that the replacement therapy reduced if an oral rinse of antifibrinotic agent is given, then the chances of replacement therapy is reduced after the dental extraction. Des- if we use desmopressin, which is the synthetic derivative of the hormone vasopressin, that will increase the factor 8 level in some patient with the mild or moderate type of hemophilia A. These are the systemic management. I'm not going to discuss in detail because my seniors, respected seniors, will discuss all these things. So with this, I was like to conclude my presentation that hemophilic hemophilic patients are privileged to the group of the uh, privileged group for the dental professionals. So uncontrolled bleeding during dental procedure may be life threatening. So anticipatory care of this patient is indispensable for successful dental treatment. So care should be taken during the management, and although various modalities are available for breeding, but thorough medical history or consultation with the hematologist is always helpful for the future complications.
These are the references of my presentation. Thanks for patience listening. These are my some publications in national and international journals. Thank you. Thank you. Thank you. Thank you. Thank you.
With this, I finishes my presentation, and if you have any query or you have any doubt, just ask me. I, my number is displaying below the presentation, and follow me on the YouTube, Instagram, Facebook,